Hi, my name is Dr. Hani Talebi, and I'm a pediatric psychologist. You know, I had a good friend ask me when I was younger, what are you going to do to change the world and make it better? And that was a little bit unnerving, but at the same time, really inspiring. And I thought to myself that there wasn't anything more honorable in my mind than working with medically fragile children and their families to try and improve their quality of life. And it's something that I've pursued for kind of my entire career, and I really enjoy it. I chose my specialty primarily because I was very motivated to spend time at the nexus of the crossroads of mental health and medical health. And years ago, it was a pretty underserved population, and the medical model oversaw all of behavioral health, but there were a lot of gaps. And so bringing our specialty and our expertise into that domain is really powerful, and it can be an incredibly helpful type of intervention for a lot of families and a lot of the colleagues who are in the hospital setting who could use that support. Our team takes a value-based, patient-centered approach to care. And working as a hospitalist is a very interesting experience for a lot of us because we have the opportunity to see families at their most compromised and their most vulnerable. And so we work very hard to ensure that they possess and retain a sense of agency and a sense of control in an otherwise very foreign and helpless environment. And so being able to meet families where they're at, knowing that we have a lot of families who are immigrant families, who are from ethnic minority groups, who are undocumented. We've done everything in our power to ensure that we are giving them every chance that everyone deserves, child, family, to be able to prosper and do well as they are here in the hospital and they move forward post-discharge. Listening, in psychological terms, we would call it reflection. And so we mirror what we hear. And in many ways, that supports individuals in one, feeling validated, in two, normalizing their experience, and in three, supporting them to continue talking. And a lot of times what we tend to do is you talk, I talk, you talk, I talk. In the hospital setting, sometimes we think of ourselves as the experts because of our fund of knowledge, whereas in reality, families are really the experts on their children. And so we want to honor that. And in order to do that, we have to listen, we have to reflect. Sports and being physical is a really nice counterbalance to the intensity of the work here. Making sure that the vicarious trauma of kind of what we see day to day doesn't overwhelm us and lead to burnout. So being able to be physically active is really important. Friends, connection, reading is really a nice kind of venue to be able to exercise a different part of your brain. And art, expression, musical interests, things of that nature, they're always welcome kind of distraction from the regular day-to-day.